My name's Dr. Greywall. Jas is my first name and I'm a consultant psychiatrist. I am dual qualified in general adult psychiatry and addiction psychiatry. I work full-time in the NHS in Coventry in emergency psychiatry. There I treat patients with severe mental illness such as schizophrenia and manic depressive psychosis. I'm also an addiction psychiatrist and I've been working in addictions for the last 15 years. What I like to explain to my patients are a few things. One is what we know beyond any doubt is that addiction is a genetic brain disease. So this runs in families. It also is an illness that affects not only the patient themselves, but all the family. This is not a moral failing or somebody's lack of willpower. This is a disease. This is an illness. Here at ESH, I play a central role in reviewing patients before they are admitted. So really the main purpose of that is to make sure that the prospective patient is medically safe to be admitted and to plan any detox that's necessary. So I will have a comprehensive detail of their medical history, their psychiatric history, and what they are drinking or what drugs they're using. So I will review that and I will determine whether they're safe to come in. Most importantly, we will have all the medication that will be necessary for a detox ready at the point that the patient is admitted. I think it's important to explain what a detox actually is. So the proper medical term is a medically assisted alcohol detoxification. Now, most of the patients that come here to ESH have an alcohol detox, but we will also detox patients from drugs as well. So just focusing on the alcohol detox. I think it's useful to talk about what happens in the process of daily drinking. So the body and the brain exists in balance, and there's a balance between the sedative and the excitatory neurotransmitters in the brain. So for a patient who's drinking alcohol daily, they're putting in an external sedative every day. So the body's natural sedative chemicals just stop being released. So then what happens is when that person stops drinking suddenly, there's an imbalance and there are none of the sedative chemicals, and there's a huge amount of the excitatory chemicals. So it's this that gives rise to alcohol withdrawal symptoms. So these will range from a restless night's sleep, sweating during the night, waking up at 5 o'clock in the morning, the stomach churning, the nausea, the retching and vomiting. When someone is drinking daily, they know that the only thing that's going to fix that is having another drink. So what happens in the detox process is that we need to give a medication, and the medication that I prescribe is diazepam. And diazepam is a sedative that works in a similar way and in similar parts of the brain to alcohol. So giving diazepam regularly 4 or 5 times a day will prevent any alcohol withdrawal symptoms. So that is what a detox is. It is giving a drug, a sedative drug like diazepam, 4 or 5 times a day over the course of roughly a week in a reducing amount each day to prevent any of the really uncomfortable alcohol withdrawal symptoms. Many patients, when they're, well, if not all patients, are very nervous about coming into a rehab facility because they're worried about the detox. Now, because I have years of experience of doing this, I ensure that the detox is effective, and we have protocols in place to ensure that. There are different ways of managing a detox, and I use a combination of techniques. One of the techniques is called front loading. So this means that you give enough of the medication in the early stages to ensure that there is immediate control of alcohol withdrawal symptoms. And what that means is, as I've already said, the medication is available prior to the patient coming in. As soon as they experience alcohol withdrawal symptoms, they're given a dose of diazepam. They are then assessed after 1 hour, and if the symptoms aren't controlled, they're given another dose, and again after an hour, another dose if needed. So doses of diazepam will be given at hourly intervals until we are certain that the alcohol withdrawal symptoms are adequately and well controlled. This applies also if we're detoxing somebody from a heroin addiction, for example. We will give medication at an early stage in sufficient quantities to ensure that the symptoms are well controlled. And what I like to say to the staff is that the state that I'm aiming for within the first few hours is for, when you ask the patient, so how are you feeling? I want them to reply, oh, yeah, I'm feeling fine. In fact, I think I might need to lie down. So, well-controlled symptoms at the earliest possibility. In patients who are struggling with alcohol or drugs, they will invariably have been seen by their GP or other doctors beforehand. Many patients come with existing medication. So generally what I will do is I will continue their regular medication. So if somebody is on an antidepressant, that will generally be continued. In my experience, everyone who struggles with alcohol will also struggle with low mood and anxiety. So what we find is that typically the low mood the mood will lift by itself. So simply with abstinence and an effective detox, you will find that on day 2 or day 3, the mood lifts. So it's normally the mood lifts and the appetite returns at about the same time. So generally, you don't need any additional treatment in terms of mood. Anxiety is somewhat different, and invariably, all of my patients who have struggled with alcohol or drugs will have an overactive mind, the sort of mind which is always thinking. They are sensitive, they are prone to overthinking and over-analysing. It's important to recognise that this is part and parcel of what happens in addiction. And generally it is the psychological treatments that happen here at ESH and the engagement with recovery in the longer term that leads to the slowing down of the brain, it leads to a lessening of the overthinking, and whereas people might feel that they have no control over their thoughts, their thoughts are running all over the place. What patients learn in recovery is how to control those thoughts and even achieve a state where their brain is calm and serene. And that's certainly our aim. The important thing that we all need to understand, and it's certainly a message that I like to get across to my patients, is that addiction or alcoholism should be viewed as a chronic illness in the same way as we look at diabetes and asthma as chronic illnesses. So this does not mean that you can come for a 4-week detox, get fixed, and then you'll be okay. It doesn't work like that. Coming here for a detox is often an essential first step. Certainly the therapy and the psychological treatment that is started here is a great introduction into recovery. But what I will tell all of my patients is that those patients who engage in long-term recovery, and this is usually in a mutual aid group. I mean, I'm a strong believer in 12-step groups such as Alcoholics Anonymous and Narcotics Anonymous, but there are other mutual aid groups available as well. I will stress that those patients who engage in long-term recovery tend to do well. Those who do not tend to do less well. In summary, why I love being a psychiatrist, and in particular working in addiction psychiatry, is that I can make a huge difference to not only the patient but also their family in a very short time. So I can take patients who are totally out of control in terms of their drinking, whose lives have become unmanageable, whose family are often despairing, and you can just turn this around 180 degrees within a few days and within a few weeks. And with encouragement and with continued engagement with recovery, you can have everything. You can carry on with your job, you can have a successful relationship, and you can be in a situation where your family no longer need to worry about you every day.